Hey guys, welcome to Unleash Podcast brought to you by Hidden Gen, where we talk about how to unleash your hidden potential. I'm your host, Yuri Diogenes, and we have a great episode for you today featuring Dr. Darcy. Thank you, Dr. Darcy, for being on today.
Thank you for having me, Yuri. We're excited to be here.
Absolutely. And actually, today we have three guests, but I will introduce the other ones later on. So, before we jump into today's topics, we would like to invite you to subscribe to this podcast on YouTube, Apple Podcasts, or Spotify. Also, you can visit all these podcasts in our Hidden Gen website, hiddengen.net. And if you live in the area and have not been at Hidden Gen, you can always grab a free trial pass at hiddengen.net. All right, Dr. Darcy, let's get started here. Tell us a little bit more about you.
Well, you see, I have a doctor of chiropractic, Yuri, and many years ago I actually got into studying electrical medicine, and that naturally went into regenerative medicine. And then what launched my process into regeneration was I actually got in a car wreck. I got hit at 70 miles an hour. You know, those impacts, Yuri, that you stop and the person behind you, you look and they're coming full force, and you get that massive impact. And it herniated 3 discs in my neck and back.
Wow.
Yeah, it was bad. All the chiropractic, massage, electrical medicine, all these things, it didn't fix me. I was facing surgery, retirement level event. That's when I met my now business partner, and I received what we now call Infiniti Matrix. And I watched for the first time in my career, I've been in practice now 28 years, the body repair itself, and my discs actually were able to rebuild and restore, and I was able to avoid surgery. So that's why I do what I do now, is because I'm what we call a product of the product, and it changed my life first.
All right, so that's super interesting. So, tell a little bit more about this Infinite Matrix. What is that?
So Infiniti Matrix now is derived from the umbilical cord blood of a newborn. You may recall, and many people may know, that you can actually save the umbilical cord blood of your child and they cryopreserve it. Well, we now have the technology, Yuri, to actually remove the red nucleated cells from there, making it autonomous, where we don't need any blood typing. There's no genetic concerns. And what's left behind is the building blocks and the exact ratios, the appropriate proportions, the right frequencies, and what they call expressions, or that power that's in our body and our blood to orchestrate and conduct what we call a symphony of regeneration in the body. So simply put, Infiniti Matrix is derived from a healthy mom, healthy baby, live birth. These are cells that are donated, that your body takes as its own, and it's able to restore, repair, and rebuild. And it's much like what God used to build us was stem cells. Well, we now can use that to help our bodies to rebuild through injuries, through any type of problem that's degeneration. Regeneration is always the solution.
So, it's basically stem cells.
Correct. Correct. So this is a stem cell derived therapy. And that word out there is interesting because it's not actually just stem cells. There's power, there's life, and everything we need that God gives us is what? It's in our blood, right? It's the delivery system of our body. And we've known for over 60 years that you could take cord blood and save it, and it would be regenerative. Well, we now have the ability at the FDA registered and regulated labs to make it where anybody can use it, and it activates your body's own regenerative capacities.
And there is any side effects on that?
You know, what's great about this is there's only benefits. You see, the power that created you is the power that heals you. It's already actually encoded in our DNA, where it's attracted to damage and inflammation, and it can become any type of tissue. So rather than having a side effect, the benefit could be, let's say a person came in and they had knee issues from lifting, or they had a shoulder injury, and maybe they had a little heart condition that they were struggling with. The body orchestrates the repair, and the body could say, I'm going to prioritize fixing the heart as well as helping to regenerate the knee, or fix the shoulder, or fix even some intestinal situation.
Interesting. That's and what really makes you a good candidate for this type of treatment?
Well, you know, we see all kinds of people, the people that are in pain and then have issues like we said, from sports injuries all the way down to A person we had recently this week, they were facing kidney failure. They received the therapy. They went from 33% function in their kidney to over 60% in just 2 months. So a good candidate, number one, is anyone who's looking to regenerate or has a problem they're facing from degeneration or they're looking at surgery. A great candidate is someone who is looking to stay competitive or stay healthy. So healing, the key to healthy living is healthy regeneration. So someone who's had an old sports injury that's nagging them, that could work. And then finally, Yuri, we have clients that do it for wellness. So really, anybody's a good candidate, from if they're looking to avoid surgery to where they're just looking to be and stay well and live younger and stronger for longer.
Of course, there are some specific scenarios that this is probably not applicable, right? What would be a scenario that like this would not be applicable? Let's say in bodybuilding, we see a lot of people that have full tear of their biceps, right? Completely rupture of the tendon. That's not a case for stem cells, right?
Very, very clear on that one. Yes. So if it's a complete rupture and there's a retraction of that tendon, then it's not going to be able to pull that back, or that muscle, it's not going to pull it back in. That's a surgical situation. But I got to tell you, wouldn't you want to regenerate and recover from that surgery like you were 20? And if stem cells are what God used to build us, and the surgeons are expecting that to recover, we recommend clients do this prior to receiving a surgery, because then it can get rid of the scar tissue. You can recover faster, and if you're in competition, you can get back in competition faster.
Is it okay to do after the surgery, or you would recommend before? Because I've seen people
I
doing
like to
after.
tell Well, any time is good. I like to tell clients before. Why? Because if there's any situations that are going on in a surgery, wouldn't you want to have the most powerful regenerative and recuperative process in your body already happening? So even if someone's looking at surgery, it's a good idea to have that higher recovery capacity. Or if you've already had surgery and it's messed up actually, and you've got post-surgical issues, this helps that as well.
Okay. Uh, One of the things that I read in the past is about the pricing. This is not an affordable procedure, or this is like old data. Nowadays, it's way more affordable.
Correct. So the labs have a very good process on this, and Infiniti Matrix is one of the best standards of the industry that you can trust it. Higher serologic testing. It's in a closed system, class 5 clean room, and as a result, you're correct. It's not an FDA-approved therapy, and so insurance companies and things don't cover it. But we're not talking $20,000-$30,000 anymore. A standard therapy is $6,500. That's for the whole program, regardless of your situation, whether you have shoulders, back, knees, or some organ issues. It's a program, and basically the medical team that I work with actually delivers the therapy. Like I said, my doctorate's chiropractic. I get to educate, and then the medical team comes in and is able to talk with the people and see what works best for them and deliver that therapy. So less than most people's copays or deductibles if they're looking at surgery.
Makes sense. Makes sense. Well, one of the very unique things about this episode today is that we're gonna have three guests. So I guess now we're gonna transition to Victoria, right?
Yes, and Victoria is our nurse, that she's one of our delivery system. I'm excited for you to hear her testimony of how she worked in the medical arena and how it was managing the decline, and now she works with clients to invest in their incline.
All right, so let's transition to Victoria then. Thank you, doctor. Appreciate it. Welcome, Victoria. I just finished the conversation with Dr. Darcy, and he was telling me great things about you. So let's get going here. So, what is your medical background and experience, Victoria?
Sure. So I've been in the medical field now for almost 10 years. I started as an EMT, moved on to become a paramedic, and then I worked for a long time in pediatric trauma. That's mainly my background, and then became a nurse. I moved out to Texas around 2 years ago now, kind of doing some travel nursing assignments, and then was lucky enough to meet Doc Darcy and his son at an event, similar to how, we came across with you. And I started to hear about what they were doing with regenerative medicine. And, with my background, I'm very used to the acute phases of injury. Somebody coming in with a stroke, a broken arm, say a motor vehicle accident. So I've had the opportunity to see medicine through a different lens, right? Regeneration. I mean, how great is that?
And
So
that was what really made you to decide to go to this field.
Oh, 100%. I think there are parts of medicine that are needed. I mean, antibiotics, that was an amazing discovery. The fact that we can replace a knee or a heart, I mean, those are great things. But I also think that we don't focus enough on preventative, on regeneration. Why look at, okay, so maybe you're close to bone on bone with your knee. Why don't we try to regenerate what you have instead of putting your body through surgery and now you have a part of your knee that isn't a part of you?
Yeah. Now, since you've been working with this for so long, what are some example of testimonials that you've seen throughout those years that really stuck with you, that made you believe that this is such an amazing technology that people should use?
So I've had a couple different scenarios and patients I've had the pleasure of talking to, and one of them was recently a 24-year-old male. He was in a motocross accident and injured his left foot. The injury was so bad it caused avascular necrosis, basically meaning there was a part of his foot where the circulatory system was damaged, and so he was looking at surgery. That can eventually progress to having to lose your foot altogether. So he, heard of our therapy, and within 2 to 4, I want to say it was the 4-week mark, because we usually follow up with you within the first 3 to 4 weeks. He went in for his pre-op because they were like, you need to have surgery. And they said, well, there's nothing for us to operate on. What's great about stem cells is they have the properties of angiogenesis. So that's the ability for your circulatory system to create new pathways. So essentially that's what happened. That area in his foot healed and he avoided surgery altogether. So for a 24-year-old, I mean, that's a pretty, serious injury to undergo. So for him to see, that's a great example of somebody having those healing properties so early on.
And how long it takes for this fully healed process to take on?
Sure, great question. On average, people will start to see regenerative, properties within the 4 to 6 weeks. It can sometimes take upwards of 3 to 6 months, and you have to remember, what's unique about this is every patient's different. You could come in for musculoskeletal degeneration, but say you also have a pacemaker because your ejection fraction, your heart's not working as it should. So we see where people come in, okay, so let's say it improved their knees 20%, but their pacemaker went from doing 70% of the work to 10% of the work. So we see what we call positive side effects, right? You come in for one thing, but we see these healing properties happening all over your body. So in terms of how often or how soon, it's going to depend on the level of degeneration in your body. What we try to remind people of is degeneration takes time, and so do those healing properties. But we see healing happen as soon as 4 to 6 weeks. Sometimes it can take a little bit longer. But to me, if you live with pain every day, like we see our athletes, we're helping more and more athletes. Football players, the amount of stress their bodies go under, even lifting, powerlifting. It's so easy to sustain an injury with the amount of weight that you're lifting.
But how long is the downtime? Because I also heard that when you go through this process, you have to rest for some time to allow that initial healing process to take place, and you should not push yourself. So what is the window that you can start pushing? Is like 4 weeks, 8 weeks?
Sure. So not even that long of time. So what's great in terms of receiving this therapy, so you have the option to go directly into the joint. But what we have found more recently is we've gone more towards IV. So 80% of our therapies are done IV. So all that means is we find a vein, start the IV, and it's just a 2 to 5 minute push. So those cells are going directly into your circulatory system. What's great about that is when we go into a joint, we're kind of creating more trauma and inflammation to the area because you're putting fluid in a space that isn't normally there. So inflammation can occur, and that's when you really have to kind of take it easy. That's more around the 4 to 6 week mark. But when we go IV, there's essentially no downtime. What we do recommend is maybe taking that week to kind of allow your body to rest, heal, hydrate. Because again, we don't want to introduce new inflammation to the body if we can avoid it.
Interesting.
So, but that's what's so great is IV. It's so beneficial because it's immediately hitting your bloodstream, and those regenerative properties are already beginning. It takes 3 minutes for those cells to circulate one time. So,
So
you know,
it's not that painful process that people usually go through the PRP, for example.
So yeah, with PRP or autologous. So autologous is when they take your own cells. That's when they go in, usually in your hip. You know, that's a pretty extensive process. It's a 10-minute process altogether. It's, you know, one IV stick, and within 5 minutes, those cells are already in, and you're walking out of here. So it's very quick.
But you draw the blood first.
So what happens is those cells stay here in our clinic cryo-frozen. We pull them from the cryo freezer. It takes about 5 minutes for them to thaw. After that 5 minutes, we immediately administer them to you. So again, the process of when you get to the clinic to when you receive your cells is around 30 minutes. You're rarely here more than 45 minutes to an hour.
Wow, that's amazing.
And it is. And what's great is, you know, and the side of this I love is we're constantly looking at evidence-based practice, formulating case studies, because we have all this data and we have the ability to say, look, 80% of our people who come in here for knee injections see 3 to 4 millimeters of meniscal growth. You know, we have that data. We have the ability to measure these things. And so that's another great thing. Everybody who comes through here, they're helping future patients as well.
That's amazing. I had no idea that this was the process. So really good to know, because I know that a lot of people, they avoid this because they think that it's similar to PRP. And in PRP, know that it's extremely painful.
Yeah, and not just that, but this is far more robust than PRP. You're receiving around 20 million cells at the time of therapy. One cell in 30 days becomes a billion.
Wow, amazing.
So,
and there is no... I asked this to Dr. Darcy, but after you finish this process, do you get any side effect? Like you get a little bit dizzy, or there is nothing?
So sure. So in terms of like long-term side effects, no. You know, we've done over 200,000 therapies with no rejection. Within the first 1 to 2 days, there's something that can occur called a Herx reaction. All that is an immune response. So if you think about it, you're flooding your body with 20 million cells, 20 million young, healthy, robust cells. What happens as these cells, you know, are circulating through your body is they'll start to pull toxins. So if your body has an influx of toxins and your immune system can't keep up with expelling those toxins, you'll have a histamine response. So some people can experience a headache, runny nose, nausea. That's, I would say, 10% of the 90% of individuals that come in here, and it usually subsides within 1 to 2 days. Okay. And again, we monitor you throughout the entire process. So if something like this occurs, we're there with you and talking you through it. But no serious side effects, no rejection. It's very safe, very effective.
Awesome, Victoria. Thank you very much. And we are now going to transition to our third guest, Justin, right?
Yes, Justin's great. He's definitely like the future of this. He knows how to talk to those athletes. So awesome. I'm excited for y'all to talk to him.
All right, cool. Thank you, Victoria. Appreciate it.
Thank you. You have a good one.
All right, Justin. It looks like we kept the best for the last, right? Everyone was talking about how great you are. So let's get started here with the first question. Why did you choose this career path?
Yeah, man. Well, as I'm sure you heard from Dr. Darcy, I am his oldest. And so, you know, being a kid and watching your dad go from basically debilitated, you know, hurting every day. They literally told him career-ending level injury. The surgeons were like, man, we got you now. You know, being a chiropractor, go under that knife. But those surgeons were hot and heavy on him. And he, you know, as you heard, decided not to go that route, did that stem cell therapy, and I literally saw my father's discs in his back regenerate. I mean, if you look at those x-rays, you see from the first time the accident happened how bad it was, and literally every single disc had growth. He's pain-free now. And so growing up, I was really super inspired by that. You know, it's a no-brainer for a kid when they watch their dad, you know, their superhero in a way, go from, you know, what they were to what they are now. And so for me, that was really my inspiring piece. And then once I got more involved, man, I just saw the world needed something different.
Mm-hmm.
We're so in on the medical stereotype of this is the way it's always been done. This is the way it has to be done. You're sick, you get a pill, you break something, it's surgery. Always under that mentality,
Yeah.
when really we kind of need to have a mindset shift of there are new and different things out there. And we kind of, as a kid, you always tell the old people, your parents, get with the times.
Mm-hmm.
And as a medical society and a community, I believe that it's time to get with the time a little bit. And there are new advances and things that are happening that can change people's lives in a way that we've never been able to see before. And so really, when I got started, seeing that is what keeps me here every day, and it's what keeps pulling me back.
That's cool. That's cool. Now, why? I mean, you already said many reasons, but why do you believe that this is so important for the fitness industry?
Yeah. So in fitness, well, here, let me back up. When I first started, this was really a grandma, grandpa type of thing. It was people on their last leg that were last ditch attempt efforts of let's just try this and see what happens. And the beauty in all of that is we've seen amazing stories. We see amazing things every single day with people like that. And so my mindset then began to shift of, why are we waiting? Why are we waiting until the last ditch attempt effort and waiting until we have nothing else to do to really give this therapy a chance? And as young people, as we regenerate quicker. You go out and get this huge lift in when you were 20 and you're waking up and doing it all over again the next day. And now it just seems like things become a little bit different. The soreness lasts longer. We have to take some breaks, things like that. And so for me, my mindset went to, if we start this now, and if we start this, say, when we're young or as athletes that are really serious about our health and the way that we treat our bodies, that's going to lead to avoidance of major declines, degeneration, things that are going to hurt us heavily in the future. So for athletes, and as you heard Victoria say, man, everything is trauma.
Yeah.
Whether you're getting tackled in football, you're coming down on your knees in basketball, you're deadlifting, man.
Mm-hmm.
Even those squats, I mean, we know how those affect our back if we go too heavy on those. Everything is degeneration. And so if you're doing a regular regimen of, say, Infiniti Matrix Therapy once a year, once every 6 months, and for some it's even one time, man, that makes a difference, you're going to see a world of change.
Yeah, that's what I was going to ask. I thought that this is like one-time treatment only, but you're talking about once a year. So what is the cadence that you recommend, or depends on case by case?
Yes, sir. That's a great question. So I'll tell you, about 80% of our patients are one and done, meaning that they receive therapy one time, they achieve the results that they're looking for in that period. We have a 3-month follow-up process where we are super diligent. Our staff here is about following up, seeing how you're doing, what you're noticing change-wise. And at that third follow-up, a lot of times we see these patients and they're just ecstatic, man. They're ready to yell this from the rooftops. And after that, we never see them again. Glory be to God there.
Mm-hmm.
Now, there are other cases, and this is kind of the side where I would like to shift people's mindset to, of this is a general wellness practice and can be as well. While we have one and done therapies and people get the results they're looking for, why would you ever want to go back to that degenerative state that you were in? And a lot of times that's what happens with people is they say, I never want to go back to that, or I have this other thing I'm dealing with, or if there's something I'm unaware of, these stem cells can prioritize that and take care of issues like that. And so for me, it's really a case-by-case basis, but a regular regimen of this could really change some lives and change a lot of things and help us, like Doc said, live younger and stronger for longer. And, in my world these days, I'm kind of changing the lingo to compete stronger for longer, man.
Yeah.
That's what we want to do as athletes. We don't want to stop doing what we love.
Right.
So stay out there, man. Stay on that field. Stay in that gym. Do what you love.
I think that one of the misconceptions probably is that with stem cells, at least the way that it was applied in the past, it was very directive to one specific body part, right? And Victoria was explaining to me that the way that you guys do is via IV. And with IV, it affects your whole body, right? In the past, it was directly to that joint, directly to that place, to affect that place only. So the way that you guys are doing, it will have benefits to the entire body, correct?
Yeah, here's the way that I like to put it, man. I personally prefer the IV. And why do I say that? It's because it allows, and I'm sure you heard them say this, it allows your body to be the author of priority. Say you have a heart issue and a knee issue. The beauty about this therapy is that your body prioritizes what's vital to itself. And so it's going to go fix that heart issue and then go to that extremity. Now, with your question, and one more time I just lost, what was that end question that you had for me there?
No, I'm just saying that the misconception that people had with about stem cells is that you have to apply
Yeah.
on that place that is hurting, for example.
The joint, yes, yes. Now I'm caught up. I apologize. So the way that I like to put that is I prefer the IV for the reasons that I just said. But some people prefer that joint injection, you know. Some people think needles are therapeutic, man, and they are. Some people look at that and they say, hey, if I'm not getting this in the area that it hurts, nothing's happening.
But
And to
that's
me,
more
man,
psychological, isn't it?
exactly, and I agree with that. Mindset plays a role in health, man. Yeah, I'm big on speaking it, you know. If somebody comes in and they say I have this, I have that, one thing Doc has told me is, man, we cancel that stuff. And so you got to speak into existence what's going to go down. And so when people come in with that negative mindset, I believe it plays a factor. And so it's kind of the best of both worlds with this stuff is we can put an injection into that knee and do an IV. In my opinion, putting it in that knee, it's kind of like dropping soldiers off at the front line, if you will. You know, and then we're also allowing your body to be the author of priority. So it's really up to the patient. It's a case by case basis.
Oh, so you actually have both options.
Yes, you can do both. And it's up to the medical team. They'll kind of give you their opinion on what they think would be best case scenario. But like Victoria said, about 80% of our patient base comes in and really prefers the IV.
There is any difference as far as which one will kick in like more rapidly? For example, if you do directly on the joint, is it fast? Does it heal faster, or it doesn't really matter?
It really doesn't matter. And it's all like you said, it's all a mindset thing, man. And so if somebody comes in and says, I want this in my knee, what am I going to tell them? No, you know?
No, but do
I'm like,
you
"Sure,
try
we
to
can do
do
this."
you try to educate?
Well, we always educate, you know, we'll say this is what happens when you receive an IV. As you heard, you know, 3 minutes and they go through the body one time. One cell out of that 20 million is a billion in 30 days. Stuff that's amazing like that. And so what better delivery system than your bloodstream? But man, if somebody looks at me and says, hey, I want this in my shoulder, great. Let's do both. Why not? You know, as long as I get these cells in your body, I don't even have to be right with what's wrong.
Yeah, that's amazing. That's I love that comparison. Yeah, I fully agree with you. Now tell us a little bit more about this partnership with Hidden Gem.
Yeah, man. So I got to meet Greg through a couple church events. Awesome guy. I have a lot of respect and I honor him, man. What you guys are doing over there is huge. It's great. It's changing the game, man. You guys are taking a gym, making it clean, and making it accessible to everyone, and I'm about that. And so when we saw what you guys were doing, I'm big on divine alignment. And so I got to meet Greg and was just like, man, this dude has a passion for something that I have a passion for.
Mm-hmm.
You know, getting to these athletes in a way that they prefer to be got, you know.
Yeah.
Not just telling them that there's one certain way to everything. There's differences that you can do, and just inspiring people through motivation and just being there at their side. You know, you guys do a great job of really making everything personable.
Yeah.
And so for me, you know, that was a divine alignment, man. And after that meeting with him, I was like, man, we're going to change some lives with this, because what you guys are doing in the fitness industry, it's changing lives, man. And I believe that what we're doing here in the medical industry is doing the same. So for me, when things line up like that, I know God's moving in great ways. And so we've got a lot of, first of all, passion for you guys and what you're doing, and want to help in any way that we can. But I'm excited for the future with you guys.
Yeah, it is so important for longevity, right? Because some master athletes, after 40 athletes, that they want to keep pushing, but sometimes they just are not able because everything hurts. And there is always some small injuries that with time gets worse. So this helps with longevity.
Amen, bro. I'll end with this, and this is kind of like my call to action, if you will, man. Like I said, we want to make you guys compete stronger for longer. That's what it is. And as, you know, man or woman, doing what you love, it's what you're passionate about. And to lose that passion, that's not something that we want to do, man. We want to allow people to keep doing what they love for as long as they can.
Absolutely.
And so I would urge, you know, anybody that's dealing with this pain, man, stop managing your decline. Quit managing it. Stop trying to find that pill and start investing in your incline, man. This is something that we get down to the root cause of. The stem cells know where to go. Your body tells them that, and it's what God's always done. So just let them work, and we're just blessed enough to be the medium by which you get to receive it. So I challenge anyone, man. We can help. As you heard, the spectrum is very broad. And athletes, man, you guys regenerate at a faster pace anyways. And so imagine the potential and the capabilities that you could have in doing therapies like this. You know, I notice when I receive mine, my recovery rate skyrockets, you know, and that's just in the time that I receive it. So bring it on, man. We're here to help as many people as we can.
Awesome. And how can the people reach achieve your clinic?
Great question, man. You can reach us at our website. It's www.achievevitality.net, or you can call our office. You can ask for me anytime. Our phone number is 972-303-0683. Man, come with your questions ready. I'll be ready to answer, man. I'm just here to help people and change as many lives as possible.
That's amazing. I'll be soon visiting you guys for sure.
Yes, sir. I look forward to it, my man. I appreciate you so much for having us on. God bless you, brother.
God bless you too, my friend. And keep up doing the great work.
You guys as well, man.
All right, everyone. That's a wrap for today's episode. Thank you very much for tuning in. Stay tuned. We have much more to come.